64 miles or 103 kilometers to the west of Kingston, Jamaica's capital, lies Mandeville. This is the capital and largest town in the central parish of Manchester. Mandeville was slowly stirring to life, but at the eye clinic located at the Mandeville Regional Hospital, several persons from across the parish and beyond had already arrived. The Mandeville Regional Hospital serves a population spanning the parishes of Manchester, St. Elizabeth, that's located to the west of that parish, Clarendon to the east, and St. Anne in the north. The eye clinic is representative of a case study of an innovative government partnership for eye care. The Caribbean Council for the Blind and the Foundation for Eye Care in the Caribbean, with support from Sightsavers, initiated this partnership with the Mandeville Regional Hospital. The partnership has significantly improved the eye care services available at the institution. This is always evident by seeing the number of persons seated in the clinic on any given weekday before 7 in the morning. It's here that some hope to get their eyes tested and others are anxious about the possibility of being approved for a surgical procedure, be it the removal of a cataract or a pterygium. Monday is the day dedicated to surgery, but before the actual procedure begins, those seated in the waiting area participate in the devotional exercise. This has become a part of the fabric of the clinic. Once that's over, the usual routine begins. The patients are thoroughly checked. On this particular morning, we met up with 79-year-old Kenneth Higgins. He's now retired and he's from the neighboring parish of Clarendon. He came to the clinic for surgery. This is his second time around to remove a cataract, this time on his right eye. Then there was Winsome Robinson. She was also here for surgery, but in her case it was the removal of a pterygium. The patients, after being prepped, headed to the operating theatre in another section of the hospital. This is where Dr. Gavin Henry takes charge. Kenneth Higgins is Dr. Henry's first patient. Dr. Henry carefully removed the cataract from his eye, implanting a new lens. In another operating theatre, Dr. Chung Quarry set about removing the pterygium from Winsome's left eye. Unlike cataract surgery, where the patients return the following day for a post-op treatment, a pterygium patient will not return to the clinic for another 7 days. 24 hours later, all the cataract patients are seated in the clinic for their check.
Very happy, man. I didn't expect that I would see out of my eye, but it's the best.
It is here that Nurse Gooden now meets with the patients and she gives them a pep talk.
Not the be all and the end all. We now have to take care of the sight which you have gotten. So there are a few little pointers for you, and I hope you will just abide by them and you will be safe. No, I would advise.
Another priority of the clinic is that of testing patients for glasses. Monica Belinfante came to the clinic from the community of New Green in Manchester. She said she was referred to the clinic by her local doctor. Cohen Blake is an optometry student studying at the University of Guyana. While home in Jamaica for the holiday, she is based at the eye clinic, and on this day she attended to Monica Belinfante. Once that was over, it was across the corridor to Audrey-Lynn Lewis, the dispensing technician. After trying on several frames, Miss Belinfante eventually made up her mind. Then Audrey-Lynn Lewis sat her down and took her through the process, how to go about making a payment and when to collect her glasses.
Alright, so have a nice day. Well, on a daily basis, I would do persons on a Monday would come in for pickup. those are persons' prescription that's sent out to the lab for the lens to bill. Then they would come in on a Monday to pick up. When they are picking up on a Monday, you normally would find persons coming in from the bank with payment also, and also persons coming in from the refractionist area for me to help them to identify a frame and to do their seg height and their PD. Segment height, which is to do the reading part and for the distance.
Oh, okay. On average, about how many people you think you'd see each day?
On a Monday and a Tuesday, it's not too bad, but like on a Wednesday and a Thursday, sometimes about 12 persons seen from the refractionist area, while you have persons coming in from the bank with payment, with their voucher slip, and the persons picking up also.
As with everything, there's always a time for change. And only recently, Sister Evans Powell took over the reins of heading the department from Nurse Gooden.
It's been great so far, I'm enjoying every moment of it. A lot of difference from the other side of the hospital. So I'm getting into things, getting to know how things work down here. Come in the morning. If I reach here before 6 o'clock, patients are waiting, right? So I try to continue on that trend. When we come in the morning, normally the patients are welcome inside, and then we sort out their dockets. We normally prepare their dockets from the day before, right? For those who have appointments. We have different days, right? So on the Mondays is our general surgery day for them. They'll come here, being prepared to go up to theater, right? So they'll come down here, their intraocular pressure is tested, and after that now they are sorted out differently. They sign the consent form, and their blood pressures are checked. They are given medications to reduce the pressure in the eye, and if their blood pressure is high, they might have to be referred to the doctor to be sorted out. Otherwise, they might give them medication to reduce it, or they are sent home and given another appointment. Right? And that's what we do on Mondays, basically. And then you have the emergency cases coming in, right? And you have refraction going on a daily basis. They have refraction and dispensing of glasses on a daily basis. On Tuesdays is now our post-op days. Those patients that are done on Mondays come back on Tuesday morning, and we'll take off their dressing, see how the eyes are doing. And we have what we call a cataract pack that everybody should get paid for on Monday mornings, right? So by Tuesday, they will have those ready for them. So on Tuesday, they're sorted out. They're given appointments to come back. And all the patients are seen, all the post-op patients are seen by the doctor who did them the day before. Wednesday and Thursday now is a bigger clinic where we have the glaucoma patients, most of them coming in. So most times the places are so crowded that we have to open the back grill there. If you go outside, sometimes they're sitting on the back of the barn. And we sort them out.
Fridays is what kind of day?
Fridays now we have post-op day, and we have what is called nurse-led clinic. On the nurse-led clinic now, the intraocular pressures are checked for the glaucoma patients. If they're on normal basis, then we will just talk to them how to continue using their drops, the importance of the drops and all of that, what is done by the nurse, right? And those don't see the doctor. If the pressures are up, then we refer them to the doctor. And then we have the pre-op preparations for those coming in on Monday. So we have actually 3 clinics going on Friday.
And the work continues non-stop. Every day, Monday to Friday, the eye clinic at the Mandeville Regional Hospital is chock full of people and abuzz with activity. And now CCB Eye Care Caribbean, with financial and technical support from Sight Savers and other partners, are in the process of transforming the clinic. Once done, the area will become a suite of 2 operating theaters dedicated to eye surgery, replacing the current situation where the ophthalmologists at the hospital are limited to up to 1 surgical day each week. And all of the hard work has not gone unappreciated, as we hear from these patients.
We have very, very good service.
Mandeville Clinic, Eye Clinic. I and make her feel very good.
The clinic has come a long way, and CCB Eye Care Caribbean now projects that the annual surgical output will triple by 2012 to about 1,800 surgeries in that coming year.